If the tongue body color is pale or pale red, the stomach yin can be regenerated within weeks or months. So we're talking about the disappearance of the tongue coating, provided the diet has been rectified. If the tongue signs appear with a red tongue body, it indicates stomach and kidney yin deficiency, suggesting that the healing process will take longer. Let's now take up this 22-year-old male case, another case. Tongue is pale red, slightly swollen sides. You notice some small cracks at the center of the tongue. Then we have a dry center without coating and yellow thin coating at the posterior third. Patient complained of severe itching of the skin, appearance of damp red skin lesions, no appetite, feeling of fullness after eating, soft smelly stools, night sweats, inner restlessness, depressive moods. Western diagnosis is atopic eczema. Background to disease, family history of eczema, alcohol and caffeine abuse, long-standing emotional problems. So TCM diagnosis, spleen chi deficiency with accumulation of dampness, onset of stomach yin deficiency, and slight retention of damp heat in the lower burner. Next, we have a 37-year-old male whose tongue is described as red, wide, and thin, with peeled red and cracked center. The edges are curled up and slightly swollen, and the tip is reddish and curled down. Coating is yellow, slightly thick, with red points at the root. Symptoms: constant headache, migraines, inner restlessness, occasional stomach pain, smelly loose stools. No Western diagnosis. Background to disease: trauma, sustained fracture of the skull 2 years ago, alcohol abuse in the past, excessive consumption of spicy foods, and emotional problems. So TCM diagnosis: there's injury to fluids due to heat, stomach yin deficiency with heat in the stomach, liver qi constraint with heat in the liver, and the tip pointing downward, and it's red. There's heat from deficiency in the heart and accumulation of damp heat in the large intestine. As you can see, there are red spots aside from the slightly the yellow tongue coating at the posterior third. Next, we have a 54-year-old female whose tongue is described as pale red and swollen, with thick greasy coating on the left side. Coating without root, so we have a rootless coating, deep crack in the center with yellow greasy coating. Symptoms: loss of hearing in the left ear, tinnitus and earache, panic attacks, inner restlessness, nervousness, dizziness in the morning, headaches, insomnia, and occasional night sweats. Western diagnosis: acute loss of hearing. Background: excessive demands at work and emotional problems. So the TCM diagnosis, we have spleen chi deficiency with accumulation of dampness, accumulation of damp heat in the liver and gallbladder, and stomach yin deficiency with accumulation of phlegm fire in the stomach. Next, we have a 66-year-old male whose tongue is described as red and the shape is firm. Coating without root at the center and root. Yellow old coating. Symptoms: severe constipation, heartburn, stomach pains, extreme physical weakness, night sweats, pain in the bones. Western diagnosis: prostate cancer with metastasis to the bones. Background to disease: overwork, emotional problems. TCM diagnosis: stomach and kidney yin deficiency, accumulation of damp heat in the large intestine. And then we have the 32-year-old female whose tongue is described as pale red and swollen, with red big slightly raised points in the anterior and middle thirds, yellow slippery coating. Symptoms: swollen red tonsils, frequent sore throats, frequent otitis media, irregular menstrual cycle. Western diagnosis: chronic tonsillitis and habitual miscarriages. Background: overwork and emotional problems. Chinese diagnosis: spleen qi deficiency with accumulation of dampness, toxic heat lodging or festering in the upper burner, and accumulation of damp heat. Finally, we have the case of a 36-year-old female whose tongue is red with red sides, deep red points on the anterior third and sides, yellow thick greasy coating at the center and root of the tongue. Patient complained of sore throat with hoarseness, strong night sweats, insomnia, inner tension, flatulence, cold hands and feet. Western diagnosis: acute cold. Background: difficult divorce, repressed emotions, overwork, lack of sleep. TCM diagnosis: we have heat in the liver transforming into fire, toxic heat lodging in the upper burner, and accumulation of damp heat in the middle and lower burners.